Welcome to the Adherence Module. In this module, we will define medication adherence and explain why it is important, recognize who is affected by non-adherence and why it is a problem, describe the impact of adherence on outcomes, and list appropriate tools to aid in increased adherence. Did you know 3 out of every 4 Americans admit that they don't take their medications correctly? Studies show that physicians feel it is someone else's job to promote adherence. So, this is a great opportunity for pharmacists to make a significant impact through adherence programs. Adherence is the extent to which patients take medications as prescribed by their healthcare providers. Lack of medication adherence can lead to many problems. For example, Mr. Smith, a 65-year-old man who recently had a stroke, receives an antihypertensive medicine to lower his risk of a recurrent stroke. This medicine causes unwanted side effects for the patient, and unfortunately, he stops taking it without informing his physician or pharmacist. The discontinuation can lead to the first 2 points in our slide of unnecessary disease progression and disease complications. Furthermore, if he continues to not use his medicine, he is at an increased risk of a second stroke, which may cause the last 3 points of our slide: reduced functional abilities, lower quality of life, and even death. Many people believe adherence only affects the patient, but in actuality, it can affect a multitude of people. In fact, poor medication adherence causes $100 billion per year in avoidable hospitalizations. Nearly $300 billion per year is wasted because patients do not take their medications properly, and also a typical mid-sized employer with $10 million in annual claims might be wasting over $1 million due to non-adherence. An example of successful medication adherence can be seen in the 1997 Asheville Project, in which 12 community pharmacies in Asheville, North Carolina, implemented community-based pharmaceutical care services for patients with diabetes. They monitored changes in A1C as well as changes in diabetes-related and total medical utilization and cost. Pharmacist interventions included long-term follow-up using scheduled consultations, clinical assessment, goal setting, monitoring, and collaborative drug therapy management with physicians over a 5-year period. The following results show that the Asheville Project was very successful. Economic outcomes of the project include that for every $1 spent on prevention, the health plan saves $4 in treatment. There was also a decrease in average healthcare cost of $2,000 per patient annually. Sick days for employees were decreased by 50%, and hospital visits decreased by 50% in 2 years. It revealed a decrease in average A1C from 8 to 6.8 for individuals enrolled in the program for 5 years. And within 3 years of enrollment, 50% decrease in likelihood of complications. So who is affected by lack of adherence? Healthcare professionals, patients, employers, pharmacists, and taxpayers. In the next few slides, we will discuss how each individual group is affected. Up to 69% of hospital visits are medication related. Therefore, compliance with medications could cause a dramatic decrease in hospitalizations and total medical spending. Patients who correctly take their medications could possibly avoid unnecessary disease progression, disease complications, reduced functional abilities, lower quality of life, and death. All of these can improve the outcomes for the patient. Medication adherence can improve employees' health. A healthy employee is less likely to have sick days. This can improve productivity of the employee, therefore benefiting the employer. Adherence can affect pharmacists as well. When patients are satisfied with their medications and the outcomes, they will return regularly to refill these medications, which therefore increases revenue to the pharmacy. Pharmacists should look beyond auto refill and refill alert programs in order to improve medication adherence. The ideal medication adherence program would include multiple interventions targeting different factors for decreased adherence. Later in this module, we will give you more tools to help you determine what methods work best for your patients at your practice site. As stated earlier, poor medication adherence causes $100 billion per year in avoidable hospitalizations, and nearly $300 billion is wasted because patients do not take their medications properly. If medication adherence is implemented, this could benefit taxpayers in that less money is spent on unnecessary medical expenses due to poor adherence. As you can see, lack of medication adherence can cause serious consequences for the patient. Reasons for lack of adherence include cost of medications, adverse drug effects, complicated medication regimens, patient willingness, patient-specific barriers such as lifestyle and support systems, and provider communication between the patient and other healthcare professionals. If the cost of the medication is causing a patient to be non-adherent, some methods you can use to improve adherence include generic substitution, switching to a long-acting medication to decrease the number of doses, or cutting a pill in half to decrease the quantity. If the patient is not taking their medication due to an unwanted side effect, you can talk to them about their concern and provide patient education about the medication. You can also recommend symptom control to manage the unwanted side effect or switch to another medication if the side effect is unbearable. If a complicated medication regimen is causing the patient to be non-adherent, you should perform medication reconciliation to decrease the total amount of medications necessary. You may also switch to combination medications to decrease the total number of medications. If these options aren't possible, recommend using a pill box or blister packing to make it easier for the patient to stay on track. If patient willingness is an issue, try to positively reinforce the benefit of taking medications as prescribed. Most of the time, patients respond better to positive reasoning rather than you lecturing them on why their behavior is harmful, so this approach might work better when motivating patients to adhere to their medications. If patient-specific barriers are present, such as forgetfulness, knowledge gaps, or lack of a support system, there are several methods you can try to improve the patient's medication adherence. Recommend using reminders such as cell phone alarms, medication calendars, and text message alerts for patients who often forget to take their medication. You should also educate the patient on the importance of taking their medications if you identify a knowledge gap. For example, some patients don't think they need to take their blood pressure medication every day because they report that they feel fine, so they don't feel like they need it. If you explain how hypertension is referred to as a silent killer because it often presents with no symptoms and can lead to heart attack and stroke, the patient may be more likely to adhere to their medication. You should also talk to the patient about the importance of having a support system at home to encourage them to stay on top of their health by taking their medications. Poor communication between you and the patient or you and other healthcare providers can have a negative impact on medication adherence. You can utilize e-prescribing to ensure effective communication between you and other healthcare providers. You can also use methods such as refill reminders and auto-refill programs to communicate with your patients. The pharmacist's role is crucial in improving medication adherence by implementing patient-centered approaches, including follow-up calls after a patient receives a new prescription, addressing any concerns the patient is experiencing, working with the patient to set goals, and providing educational materials to achieve these goals, as well as implementing MTM services. Let's go back to our previous example of Mr. Smith. The discontinuation of his medication could have been prevented by a simple phone call. For example, his pharmacist could have called to follow up on his new prescription for an ACE inhibitor soon after he'd received the new medication. Mr. Smith would have had the opportunity to describe his unwanted side effect of a dry hacking cough, and the pharmacist could have recognized the problem and offered a solution, such as calling the doctor and switching to a different medication. This easy yet important intervention may have been the key to keeping Mr. Smith on medication and thus prevented his second stroke. As you've learned through this module, this is a continual working relationship between the patient and the pharmacist. There are many factors that influence medication adherence, and the pharmacist must address these issues for positive patient outcomes. Positive patient outcomes have an impact on everyone. Now you have the knowledge and tools to improve medication adherence for your patients. Thank you for completing this module on medication adherence. We encourage you to utilize the skills you have learned to make a positive impact on your patient's health and quality of life.